All right, thank you guys so much for joining me today. I wanted to give Oklahomans an update on our fight against COVID-19. We're still in phase one of our Open Up and Recover Safely plan, and the data continues to show that we are making great progress. I want to start with the latest on testing. If you want to get tested, I encourage you to call 211, find a location close to you, and get tested. Even if you don't have symptoms and you're just curious or you think you need to get tested, we have plenty of testing in the state of Oklahoma. We want you to go get tested. We have 80 different sites across the state. We talked with the White House this morning, and we will be receiving 90,000 additional swabs by the end of this week. This will help us to continue to increase our PCR testing. And remember, we are also the second state in the country that's validated a saliva test. We're ordering more of those sample cups to continue to distribute those across the state as well. There's also really good news regarding PPE. Yesterday, we got word that we will receive 250,000 N95 masks by the end of this week. This will be an incredible help to our stockpiles as we continue to protect our healthcare workers, our doctors, our nurses, our first responders, our nursing homes, as we've been shipping PPE all across the state. Let me be clear. Protecting the lives and the health of Oklahomans is my number one goal. We will continue to turn over every rock, and I'll search everywhere for the PPE to get it into the state of Oklahoma to continue to protect Oklahoma's healthcare workers. I've said all along that we will make decisions in Oklahoma based on the data here in our state, not what we see on television. Our situation in Oklahoma is significantly different than other states. Let me show you the latest information on a graph that we put together to show Oklahomans. This chart is a breakdown of the cases per capita in all 50 states. That means it's adjusted for population. If you're watching on TV, hopefully they put this on your screen. You can see New York in the far left. Most of the New England state is on the far left, and you can see other states you recognize, you've heard about on the news, Louisiana and Michigan. And then Oklahoma is over here on the far right. We have the 8th fewest cases out of any state in the country. That's really good news. When you adjust for population, for example, New York has 16 times as many cases as Oklahomans. Louisiana has 6 times as many, and Michigan has more than 4 times as many as our state. Oklahomans, you have really done a fantastic job of flattening the curve, practicing social distancing, washing your hands, and it's really showing up in our data. This next chart shows the same thing more in a map form. It's the infection rate adjusted for population. The only states with a lower infection rate than us are Alaska and Hawaii, Montana, West Virginia, Oregon, Maine, and Wyoming. And you can see, compared to our neighbors and the rest of the country, we are in really good shape. We have the lowest, go to the next chart, we have the lowest infection rate in our region and the lowest across the entire Sun Belt. As you saw on the map, many of the states ahead of us are very spread out. And my favorite stat of all, we have the second lowest infection rate of any state with a population of greater than 2 million. I also want to show you the trend on our positive test percentages. A month ago, more than 10% of our tests were coming back positive. And when we started to safely reopen our state, on April 24th, we were at 6.3% positives. When we went statewide with phase 1 of our reopening, which was last Friday, we were at 5.9%. And as of yesterday, we are at 5.4% positive. So that means for every 1,000 swabs or saliva tests that we take, we have 54 that are coming back positive. That means 946 come back negative. You just have to remember that the situation in Oklahoma is very different. For example, in New York, when they test 1,000 people, 320 are coming back positive in their state. However, just because we're in good shape and the data continues to trend in our favor does not mean we can take our foot off the gas. As I've said before, coronavirus is still in the United States. It's still in Oklahoma. We have to remain social distance. We have to continue to practice social distancing, wash our hands, and be safe, allow our vulnerable population to work from home, etc. We need to continue all of those practices to keep the trend lines where they are. Even as we safely and responsibly reopen our state, I know that so many Oklahomans are still out of work and are struggling with their unemployment claims. Getting unemployment claims processed and paid is a top priority in my administration. I know this is incredibly frustrating for many of you. We are continuing to make progress, but like you, I wish it was quicker. I've asked David Ostro, our Secretary of Digital Transformation, to give you an update on unemployment and the work we're doing to get those claims taken care of and get those claims in the hands of Oklahomans as quickly as possible. Secretary Ostro.
Thank you, Governor. Good afternoon. We are working hard, like the Governor said, to get these things processed as fast as we can. So far to date, as of this morning, we've had about 417,000 claims. Keep in mind that this system was designed for between 1,500 and 2,500 claims per week. And so to go to these levels are just astronomical. So far, we've distributed $432 million in benefits since March 15th. Again, I just want to stress $432 million in benefits. In addition to that, we've paid over 8,000 claims for the PUA, which is the Pandemic Unemployment Assistance, which is for the 1099 employee. We continue to ramp that process up. The PUA process didn't exist. We got the guidance from the Department of Labor on a Friday, and the team over the weekend stood up the information and started collecting it as fast as Sunday, the following Sunday. And so the team is working day and night to process these things. Like in any type of natural disaster, any type of incident, we have people that are gaming us. We have some fraud. We've identified about 6,700 claims that we deemed as fraud. We're working with the OSBI and the FBI to further identify. We're looking at another large batch of suspicious transactions that we are also working with law enforcement to reduce. And we have frozen some of these claims that we deem as problematic. We want the public. I hear every day from folks that say, hey, I've been notified of a false claim, or I've had a claim notified against me. We ask that you report that to fraud@oesc.state.ok.us. I'm working on getting a better email, but that's the one it is for now. I apologize for that. In addition, our call center is making, so far we've made 1,600 calls in the last 7 days outbound for problematic claims. There's about 6,500 claims that have not been paid as of yet. 65,000 claims that have not been paid. These claims have some type of problem. Either they don't qualify, the applicant filled out the information incorrectly. So in addition to outbound calls, we are emailing these folks to try to get better information. There was a large batch that went out this morning to communicate with these applicants to get better information. Today, the OESC is running reports to identify those claims, and we're working on that. I just ask everyone to be patient as we work through these hard times. Governor.
Thank you, Secretary Ostro. I know it's been challenging, but you have led your team very well, and we're going to get through it. Couldn't ask for a better Oklahoman to be working on that. He's doing a great job. You know, speaking of also doing a great job, our Oklahoma National Guard has really stepped up in our time of need, and they've really been helping Oklahomans. We've got 360 National Guardsmen right now that are up in the fight against COVID-19, working side by side with the leadership of the National Guard. Has just been eye-opening for me, the talent that we have here in our state as citizen soldiers and airmen. They really bring a wealth of experience and talent to this fight. And as a dad of a future guardsman and the governor, I'm so proud of the work our Oklahoma National Guard has done with helping us flatten the curve and build capacity and get prepared with PPE and all the great things that they're doing. So I'd like to ask Brigadier General Tommy Mancino. He's the Assistant Adjutant General of the Oklahoma National Guard, and he's been leading our briefings and organizing the 360 guardsmen across the state. So I thought it'd be great to have him speak directly to Oklahomans, give you an update on exactly what they're doing and what he's seeing on the ground. General.
Thank you, sir. Governor, on behalf of the Adjutant General, Major General Thompson, and the 8,200 airmen and soldiers of the Oklahoma Army National Guard, thank you for the opportunity to address the people of Oklahoma and tell the Guard's story. Governor Stitt called the Guard on state active duty in response to the pandemic starting on March 17th. Our orders were clear: assist in disaster response management, provide support to state agencies, and ensure the protection of vulnerable populations throughout the state. In order to assist in disaster response management, Oklahoma Guardsmen established the Multi-Agency Coordination Center, the MAC, to act as a high-level headquarters and information clearing facility for the state. Together with state agency partners and the executive cabinet, this group of highly skilled and dedicated soldiers and airmen have provided the governor and key leadership with daily briefings on the status of the pandemic in Oklahoma, enabling a data-driven approach to decision-making. In support of the lead agency, the Oklahoma State Department of Health, Oklahoma soldiers have driven more than 100,000 miles, delivering in excess of 15,000 virus test samples from all parts of the state. Additionally, they have prepared and shipped more than 1,200 pallets of critical PPE from the Strategic National Stockpile to hospitals and long-term care facilities throughout the state. Currently, 100 soldiers and airmen are acting as contact tracers throughout the state, a critical task as we begin a phased approach to opening back up. In order to protect Oklahoma's most vulnerable populations, the governor directed we begin the disinfection of long-term care facilities. To date, more than 26 facilities have been cleaned and disinfected. Oklahoma airmen are working to ensure Oklahoma families have access to critical food resources. They've packed more than 31,000 cases of food, totaling more than 700,000 pounds, setting new efficiency records at the regional food banks in Oklahoma City and Tulsa. As the governor has repeatedly warned, this virus is not going away completely. Our motto in the National Guard is always ready, always there. I'd just like to close by ensuring all Oklahomans know that their National Guard remains vigilant, ready for whatever may come, and we will always be there for them. Thank you, and I'd be glad to answer any questions at the appropriate time.
Thank you, General. You know, as a reminder to Oklahomans, we are on track to continue with our safely reopening plan. We will continue to make decisions based on the data in Oklahoma, but we're on track to begin phase 2 starting May 15th, next Friday. But like I said back in April, the better we do with social distancing, the quicker we would get back to normal, and that remains true today. The better we do of social distancing, washing our hands, taking precautions, the quicker we can move to phase 2 and then phase 3. We always reserve the right to back up, to extend into these phases if we see the data changing, if we see any of those early indicators showing positive test increases or hospitalizations starting to peak. As a reminder, my safer at home order is still in effect for the most vulnerable population, our elderly population, through May 15th. Still important that they stay safe at home. Oklahomans, we are making great progress. The data in our state continues to look good. Thank the Lord for that. Continue with the social distancing, and we are going to get through this. So God bless you. God bless the great state of Oklahoma. We'll open it up to a few questions.
Governor, can I ask, I have one for you, Governor, if that's okay, and
Sure.
then one for the Secretary. For you, Governor, you just kind of spoke to this a little bit, you said we're on track for next Friday. Are you concerned at all that we could see an increase once we get 2 weeks from your reopening, we start to see the data from those days start to come in?
I mean, there's always a fear, of course, that we could have a resurgence in the fall. There's always a fear. That's why we're taking this slow. That's why we're moving these phases out 14 days apart. That's why we look at data every single day. So we see those early indicators. We see the testing that's coming through, the positive tests. That's why I'm amping up our testing. My goal is to have 90,000 new tests done by the end of May. We currently, right now, we're around 85,000 tests. We're upping our antibody testing, which I think is going to give Oklahomans a lot of confidence that 5-10% of the population may have already been asymptomatic, but already started developing antibodies. That's what some of the early indications may show. So we're going to continue to test. We're going to continue to watch the data, and like I said, we can obviously move phases out or back up on anything if we're seeing any kind of trends changing.
Along the lines of testing, before you go, if you don't mind, because you were talking about it. Last week you talked about Blue Cross Blue Shield for little testing. Are all 9 of those sites up and running now?
I don't know if all 9 sites, are they?
Starting this week, scheduled on our website.
Okay, starting this week, all 9 of the mobile sites will be up. That'll be in addition to our 80 mobile sites we already have up. We've never taken those down. But we wanted to take these mobile sites into some populations where maybe transportation was a problem to get testing in other, other areas of the cities that may have trouble getting to our sites. So that was the purpose of those. So I think you had a question for Secretary Ostro.
Yeah, sorry, I didn't want to get too I just, Mr. Secretary, wanted some clarity. When you're talking about claims, are you talking about all claims, or are you talking about just pandemic and assisted claims? And just for clarity, how many PUA claims have you all gotten, and how many have you paid?
We have about 18,000 in the system, and we've paid about 8,000 of those currently. We're working with our outbound calls to get most of those processed in the next couple of days. Keep in mind, it's new technology, which was very easy to build, but marrying that with the old technology to be able to process it was a technology lift. But it's complete.
Governor, you were talking about looking at data, and I think that one of the areas that you were talking about looking at data, Governor, and I think one of the areas that a lot of people think is interesting data-wise is the situation in Texas County and the Panhandle tonight. I think the numbers show that they've had 270-some total cases, about 164 current cases, and I think if you take that, extrapolate that out, that equals roughly 820 per 100,000 people. I think the state's number overall is 105 per 100,000 people, and the national average is about 375 per 100,000 people. So that situation in Texas County seems pretty intense. What can you tell us about that? Are there any extra steps being taken? What are you hearing from people out there?
Sure. And I brought our Secretary of Agriculture, Blaine Arthur, to actually address that. I want Oklahomans to know exactly what's going on. That is a hot spot up there in Texas County, which is in the Panhandle in a processing plant. And Secretary Arthur, why don't you come up and kind of give us an update on what you're doing, working with that company and what we're doing to test.
Thank you, Governor. Good afternoon. certainly very aware of the situation there in the Panhandle. The industry reached out to us very early on in this situation. They have coordinated well with other cabinet members, certainly Secretary Lothridge and Secretary Schrum, so that they could keep the health and safety of their employees as a priority there in their facility, and they have done a lot of really good things to make that a priority. Certainly keeping the food supply secure is something that's important to all of us as well. So we are very engaged with all of our ag groups and all of those commodity groups to make certain that, number one, we're keeping the health of those ag essential employees as a priority, but we're also making certain that we're maintaining a safe food supply for all of our consumers. So we have regular dialogue with them, making certain that they have the PPE that they need. Oklahoma State was able to do some 3D printing of face shields specifically for them in their location in a very short time frame. So certainly great coordination with emergency management and with Department of Health and everyone to make sure we take care of those employees, but also maintain that food supply.
Thank you. If I could follow up the governors for you as well, or Secretary, I appreciate your time. I'm looking at the executive order report on the coronavirus website that you guys have. And if I go down my county, Tulsa has 302 ventilators, Oklahoma has 358, Texas County has 2. Texas County has 20 collection kits according to this data. So are there any, broader efforts to say, well, we have a hotspot, we know this. What's the plan? Are all those patients coming to the metro areas, to the Integris and OSU hospitals, or are they going to hospitals out there? Are they going to Texas? I apologize, I don't live out there, but I just want to kind of know what the situation is.
Well, there's also, the company also has plants in Amarillo and also up in Liberal, Kansas, and so it's really a coordination between those two states as well. But across the state of Oklahoma, we have 230 people hospitalized for COVID. So even though those numbers, you have positive test cases of 239, I believe, in that county, it doesn't mean that all those folks are in the hospital. So I'd have to get specific numbers, whether they went to Amarillo. Amarillo is a little closer than even Oklahoma City for that care. And so I'm not sure where or if any of those folks are in the hospital. But I know we've sent health department folks out there to do tracing. We've also set up with Panhandle State to do housing for those positive patients or for the workers. I think the company is still deciding whether they want to put the positive patients in the housing there at Panhandle State or their actual workers because they're trying to keep that food supply, keep the processing plant open as safely as possible.
It is open today.
It is open today.
Do you have a concern about that? I mean, obviously, need food supply to be strong, but if they're, I think 100 and some of the plant employees tested positive. Is there a concern, a thought about let's shut this down for a week or two, or what?
Well, I can let Secretary Arthur. With Secretary Arthur, can go ahead and answer. Yeah,
Sorry. Thank you.
Thank you, Governor. My understanding is right now 151 of the 2,700 employees have tested positive. We've certainly been talking to other states. I know you all in the media know what goes on in other states, and we've seen processing challenges across the United States and how they've dealt with that situation. I've actually had the good fortune to chair a national committee with 16 other states that maintain all of the processing capacity here in the U.S. So we're looking at those best practices that we're seeing utilized in other states. It certainly provides challenges when we close down the facility because it is a just-in-time food supply. And so we're feeding, certainly in the pork industry, but also in the poultry industry, we're feeding animals to be just in time for consumption by consumers. And so stopping the chain of those animals is very challenging and has some unique dynamics to it. So we're trying to, again, always keep the health and safety of those employees as a priority, but also acknowledge that just-in-time food supply and looking at those best practices that we're seeing utilized in other states and solutions that they have come up with and collaborating with our partners in other states so that we can follow the CDC and OSHA guidance for those folks, but also maintain that food supply.
Thank you, Secretary.
Thank you.
You speak to your PPE coordinator, Gio DeMarco. Has anything changed in his role over the last week? And can you talk about what specific qualifications you saw in him to appoint him to this position?
Sure. So when I look to hire anybody for executive director positions or the cabinet positions, we're just looking for the most talented Oklahomans, have a lot of business experience, because running these state agencies is a lot of business acumen to run big, large state agencies. And so Gino DeMarco was a business person in the private sector, worked with an Oklahoma City guy named Jerry Winchester. They were in the oil and gas industry. We brought them out of retirement. They're running tourism, which is a $80 million state agency with hundreds and hundreds and hundreds of state employees. And so that's been my playbook. As a business person, I'm trying to bring the most talented people to every single state agency, because these are big CEO roles, and so have tremendous confidence in Gino. And so when the COVID crisis came about, PPE was critical to protecting Oklahomans. I needed it for our first responders, for our doctors, for our nurses, for our hospitals, for our nursing homes. And so that's when I wanted to put a czar in place that I knew would turn over every rock, turn over every stone, would scour the country and the world for this much needed equipment to keep Oklahomans safe. And so, you know, that's what he did, because when you think about the supply chain disruption right now, every single state is fighting for this PPE. Every country is fighting for this PPE. And I think the bigger question that really starts making us ask ourselves as Americans is, a lot of this stuff was made overseas, was made in China, and now we're all fighting the same bureaucracy to get that here. And I needed people that I could trust that would get on the phone and I knew just had a bulldog work ethic, and that was Gino DeMarco.
Governor, I'm gonna follow up on that question there. In the Emergency Preparedness and Response Service, the Oklahoma State Department of Health was set up and handled H1N1 in 2009, Ebola outbreak in 2014, Zika in 2017. They are a group that regularly, just as close as last fall, they got together and game how the state would respond supply-wise to a pandemic. So we ended up with one. Why when you have that group, they've been rehearsing, they've been going over things. Everyone, you know, in any large organization knows that supply is one of the hardest parts of that. They have gained that, prepared for that. Then why did you sideline them and go over to tourism to pick somebody up?
Yeah. So when I first went to our situation room, which is in the bunker at the Emergency Management Center, and I brought the National Guard and I brought the health department in the room with me, and my team was in the room, and I said, I want to know exactly how many gloves, gowns, face masks, N95 masks that we have in our strategic stockpile in the state of Oklahoma that was purchased by the Department of Health, the group that you're talking about. You know what they told me? They had 1 day's supply for the hospitals just in Oklahoma City. That was our strategic supply whenever I got here. That was not satisfactory to me, and Oklahomans wanted me to protect the health and lives, and so I went a different direction, and I think we've done a really, really good job of getting that supplies out. We've shipped to all 308 nursing homes, and so I don't know exactly what you mean by your question, but it's easy to play Monday morning quarterback. We could have done this or could have done that, but I have total confidence in the guys that I've got out there looking and the folks that we have working to get our PPE in the state of Oklahoma.
You talked about the 150,000 and 95 splitting right now. Can you just tell us where those are coming from?
Yeah, I believe those are. I don't know exactly what state. Is that what you mean, or what?
Just who they're coming from. Is there a group getting them? Can we buy them?
Yeah, those are coming from FEMA. Those are coming from FEMA.
Governor, I've got a non-COVID related question if we move past. The legislature tomorrow expected to pass fiscal year 2021 budget. What are your thoughts on the budget and plans to do so?
So we're still, no, my team's still looking at the budget. We're still we haven't got all the details from it. We were made aware of the budget when the news media was on Monday. We've got some questions that we're looking into. There's a couple things that we're trying to get more information on. Like, you know, the Department of Public Safety was cut 9%. The Attorney General's office got a 12% increase. So we just have some questions on why they cut certain agencies, why they gave certain agencies increases. But my team's looking through it. We're meeting with the House and the Senate, and my commitment is to get a good budget for the citizens of Oklahoma. So I'll be getting more information as I get more details about it.
Let's just follow up real quick. The legislature included in this budget is giving itself a raise. Is that inappropriate in the circumstances?
Well, that's the legislature's giving themselves a raise in this budget.
There'll be funding.
They'll be funding a raise.
They were given from last year.
Those are the questions that we have. We want to make sure that when these agencies are taking cuts, we want to look at everything, and especially the agencies that are getting increases while other agencies are taking cuts. We want to understand the reasoning why. The legislature writes the budget. It's my job as governor to sign it or to veto it, and so we're working through all those things. And my commitments to Oklahoma is I'm going to do my best to get a great budget that's fiscally responsible, that protects Oklahoma taxpayers and delivers core services.
But just to clarify, would it be appropriate for the legislature to accept a raise when it's cutting other agencies roughly 4%?
So I'll have to look into the raise there and get back with you on it once I understand what the raise is and how they funded it.
I wonder a little bit more specifically on the state budget. I mean, while you're still reviewing the state budget, the lawmakers are over there trying to shore up veto-proof margins should you veto any part of the budget. Are you concerned that, you know, in getting this budget late and now still reviewing it, that you might not really have any sort of say in it?
It's a crazy system we have, isn't it? So, yeah, sure. I mean, that's the legislature. That's the balance of power that we have in this system. I'm the executive branch. They're the legislature. They write the budget. If I don't think it's a good deal for Oklahoma, then I will veto it, and I will explain directly to Oklahomans what my problems are with this budget, and then they have the right to override that. And then they would own that, and they would have to answer to Oklahomans just like I have to. So again, this is all going to play out over the next few days. We need to really digest it. I just got that budget. My team is still going through it, and we'll have a press conference on that when we kind of get some more details on that budget.
You may have the same answer on this topic, but Aaron alluded to the Legislative Compensation Board, actually, which sets lawmaker pay. Similarly, the Judicial Compensation Board sets judicial pay and makes recommendations. The legislature in either of those instances can do nothing and have those pay increases take effect, or they can act and say, no, we don't want to do that, or limit it, et cetera, et cetera. The Judicial Compensation Board recommended 9.2% raises. The legislature did some negotiations and settled on 4.5% raises. At the same time, the judicial raises are tied to the district attorney's salaries. Meanwhile, the DA council would take a 4% cut. Have you looked into this issue at all? I'm sure you don't want to make the Supreme Court mad as governor, but what are your thoughts about the idea of judicial pay raises right now?
Yeah, you really got in the weeds there on that one.
That's where I live.
I know you do, Trey. Yeah. Again, we're going through the budget. I'm not going to make any specific comments on whether legislators should get raises or the judicial should get raises. We're going to review all that. I'm working with the House, the Senate. We still have some policy items that we're trying to get across the finish line, and again, my main goal always is to be fiscally responsible, to deliver core services. There's a lot of things we can do with digital transformation that we're really excited about. Because really this world has changed. This is a little bit of a watershed moment with COVID when we've got 33,000 Oklahomans working from home. We have all of our students out of school that are working digitally. So we have to beef up the rural broadband for our education system. And so there's some challenges, but there's also some opportunities that we can deliver core services more efficiently. And so The oil and gas is also a huge part of our budget, and with as we all know, that the prices being down, even when we get COVID back, we get COVID in our rearview mirror and we get our economy back, we're still concerned about the budget, the revenue for 2022, which sounds like a long time away. It's 9 months away. We'll be back in here with the Board of Equalization meeting, declaring the amount of revenue that we have for the 22 budget. So that's 9 months away. It's not 2 years away. And so those are all the things that I'm concerned about, and I want to get a good deal for Oklahomans. That's why I'm standing up here as your governor.
Thanks, everybody.
Governor,
Thank you.
if you don't mind.
Yeah.
As we're looking at the budget, the legislature's pointing out under control of roughly $800 million federal dollars. How do you plan on spending that? You're saying, would you give me more direction?
Yeah, no, we've got, that's the CARES Act from the federal government. We have a lot of federal policy guidelines that we have to administer that. So it can only be used for reimbursing state agencies for COVID-related expenses. Also, it can be used for municipalities' COVID-related expenses. So we will be standing up a platform that allows our municipalities to send in their requests for information to reimburse them. We'll be getting that out. We'll be standing up the platform. We're working through that right now. John Budd will be leading that that initiative. We will have input from folks from around the state to make sure we deliver those. But we know we're also setting up the fiscal part of it, where we will track that daily to send out reports to the legislature to make sure that we're transparent with the media. We'll show exactly where every single penny is spent. We've started that long ago, as soon as we started tracking these COVID-related expenses, acquiring PPE.
Can I ask you one more question?
Sure.
Elective surgeries kicking up. What are we doing to replenish blood supplies and donations and stuff like that?
So the question was blood supplies as elective surgeries. The Red Cross is always a great partner. I don't know where they stand right now in their blood supply in Oklahoma, but if they need us to continue to promote that, we'd be happy to get out in front and lead and remind Oklahomans. Just by you asking me the question, Oklahomans that are listening to this, go give blood. It would be a great thing that they can do. Thank you.